Hello and welcome. I'm Dr. Rabia Malik, and if you're here, you're likely someone who wants to take charge of your skin health and age well using non-invasive effective solutions, which is what I'm all about. Today, we're diving into the science and benefits of one of the most transformative skin treatments available, and definitely my personal favorite, microneedling. Microneedling is gaining popularity for a reason. In my opinion, it's still one of the most underrated aesthetic treatments on the market. It's been around for a while, but it isn't necessarily as trendy as some of the other devices you might hear about. But microneedling is a scientifically proven collagen-boosting treatment that can help with everything from fine lines and wrinkles to acne scars and pigmentation. But what's the real science behind it, and how can you safely include it in your skincare regime? In this video, I'm going to cover the science behind how microneedling works, research-backed benefits and statistics to prove its effectiveness, talk about some of the risks, side effects, and how to avoid complications, and give you a detailed treatment protocol, including frequency that I recommend and aftercare. So grab a cup of tea or coffee and let's get into it. So what's the science behind microneedling? Let's start with the basics. Microneedling, also called collagen induction therapy, uses a device equipped with fine medical-grade needles to create thousands of tiny controlled punctures or micro-injuries in the top layer of your skin. These devices can be either manual handheld dermal rollers or automated pen-like devices, and I use both in clinic. Either type is effective and creates micro-injuries. Why are these micro-injuries beneficial? Well, they activate your skin's natural wound healing process, which happens in 3 stages. First of all, you get inflammation. So right after the treatment, your body increases blood flow to the treated area and releases growth factors to initiate healing. Second, you get proliferation. So over the next few days, fibroblasts, the cells that make collagen, are stimulated to produce new collagen and elastin. And finally, you get remodeling, which happens over weeks to months. And this is when new collagen strengthens the skin, improving texture, tone, and firmness. Research shows that microneedling can increase collagen production by up to 400% within 6 months of treatment. A 2008 study published in the Journal of Cutaneous and Aesthetic Surgery demonstrated that after 4 sessions, participants showed a 40% improvement in skin texture and reduction in scars. This ability to stimulate collagen and elastin makes microneedling one of the most effective non-invasive treatments available when it comes to aging well. So what are the benefits of microneedling? And what does microneedling do for the skin? Let's break it down with some real numbers and evidence to back it up. First of all, microneedling definitely helps you get smoother, firmer skin. Collagen is the protein that keeps our skin firm and smooth, and as we age, collagen production drops by about 1% per year after the age of 20. So from our early 20s onwards, we're all losing collagen. A 2014 study in dermatologic surgery found that microneedling increased collagen density in the treated areas by 206% after 4 treatments spaced a month apart. So it definitely works. Secondly, microneedling helps improve skin texture. If you have rough, uneven skin, microneedling can help resurface it. In a study published in the Indian Dermatology Online Journal in 2019, 94% of participants reported significant improvements in skin texture after just 3 sessions. A reduction in scarring is another positive benefit of microneedling because microneedling is really effective at helping to reduce acne scars. A 2015 study in the Journal of Cosmetic Dermatology showed that patients with atrophic acne scars experienced a 60 to 80% reduction in scar depth after 4 sessions of microneedling. This is because microneedling breaks down old scar tissue while stimulating the production of healthy new skin cells. Microneedling reduces hyperpigmentation and melasma. For those with dark spots, microneedling can help regulate melanin production and treat existing hyperpigmentation, depending on what the microneedling is combined with. For example, a 2020 clinical trial showed that combining microneedling with tranexamic acid in a serum reduced hyperpigmentation by up to 50% in just 3 sessions. Microneedling helps minimize the appearance of pores. By tightening the skin and increasing collagen, microneedling effectively reduces the appearance of large pores because it causes a contraction in the base of the gland, so it makes the pores look smaller. A small study in clinical cosmetic and investigational dermatology noted a 43% improvement in pore size after a series of 5 treatments. Microneedling boosts product absorption. It enhances the absorption of topical serums and treatments by up to 300%. This means that your skincare products, whether that's hyaluronic acid, a peptide serum, vitamin C, they all penetrate more deeply and work more effectively after microneedling. So what are the risks and potential side effects? Well, like any aesthetic procedure, microneedling comes with potential side effects, but these are generally mild when the treatment is performed by a trained professional. Redness and swelling is probably the commonest side effect, often lasting for about 24 to 48 hours post-treatment. For most people, it looks like a light sunburn. Sensitivity. Your skin might feel tight or sensitive for a few days after a treatment. Temporary darkening of pigmented spots. In rare cases, hyperpigmentation can worsen temporarily, especially if post-treatment care isn't followed. So for example, if you go and sit out in the sun or don't wear sun protection after the treatment. Infection or scarring. The risks of these are minimal when using a sterilized professional-grade device in a clinical setting. The gold standard when it comes to microneedling is definitely an in-clinic treatment, but I do think at-home microneedling devices have their place. But keep in mind, they need to be used as directed with strict sterilization protocols, as improper use can lead to infections, scarring, or uneven results. So what about the frequency of microneedling and the treatment protocol? Well, let's talk about how often you should have it and what a professional treatment protocol looks like. When it comes to frequency, for general skin rejuvenation, I suggest starting with 3 to 6 treatments spaced 4 to 6 weeks apart. For deeper issues like acne scars or trying to treat stretch marks, you might need 6 to 8 treatments depending on the severity, and these would be at a deeper depth. And depending on the part of body that we're treating, it can be anywhere from 1 millimeter to 2.5 millimeters. When it comes to microneedling the skin on the face, all the evidence suggests that you don't need to go deeper than 0.5 millimeters to get great results. And that's particularly when we're talking about rejuvenation. In terms of the treatment protocol, we always start with a consultation. I start by assessing your skin type, your concerns and goals to make sure microneedling is the right treatment for you. Next is preparation. So on the day of the treatment, we cleanse your skin, and depending on the depth of needling, you can have some numbing cream, although when I'm working at 0.5 millimeters in clinic, I find that we don't need it. And often the numbing cream can interact with the products that you're applying afterwards, so it's not always ideal. Using a professional microneedling device, we create precise micro-injuries across the treatment area. The session typically takes 15 to 30 minutes depending on the area being treated. In terms of aftercare, after the treatment, we apply post-treatment serum to optimize results and help the skin heal. For example, my Dr. Skin Collagen serum, followed by sunscreen. After microneedling treatment, I suggest avoiding active ingredients, exfoliants, and direct sun exposure for 48 hours. No makeup should be applied to the skin for at least 24 hours after the treatment, and you really need to be vigilant about daily sun protection. Results start to appear after the first session, but peak results typically seen after about 12 weeks. So microneedling really is incredible, but for the best results, it should be part of a holistic skin health plan. In my practice, we combine microneedling with a collagen-boosting skincare routine, incorporating peptides, vitamin C, and where suitable, retinol or prescription-strength vitamin A. We also talk about optimizing internal health with a focus on gut health, balancing hormones, and anti-inflammatory diet and nutrition. All of this needs to be combined with long-term skin health strategies tailored to your needs, because that's how we get the best results and don't just address surface concerns, but optimize your skin from within. So I hope this deep dive into microneedling has answered your questions and inspired you to take the next step in your skincare journey, especially if you're not sure whether this is the right treatment for you. But if you're ready to explore this treatment, I'd love to help you create a personalized plan that fits your goals and lifestyle. You can find out about booking an online or in-person consultation with me via my website or the link below this video. Alternatively, you can join my Women Aging Well membership group, which is where I do monthly live calls with members to answer any questions and concerns, as well as monthly aesthetic treatment reviews that I test myself and give you my honest opinion on. If you found this video helpful, please like, subscribe, and share it with someone who might benefit. And don't forget to comment below with any questions. I'm happy to answer them. Thank you for watching, and I'll see you in the next video.